afternoon. Bill is not feeling well, so he's at home, and we'll send him good thoughts. And Dr. Wagner, I think you have a guest. Would you like to introduce your guest? And then if the board, we can go around and introduce ourselves and the role that we play on this. Sure. Would be helpful.
This is Dr. Paul Endry. He's an optometrist here in town, a colleague. He's the first person I knew when I moved here 17 years ago. And so he's interested in the board. I invited him to come.
Welcome. We're glad to have you here today.
Thank you. John Whitener, optometrist.
Cantor School, psychology.
Ken Putnam, I'm the engineer for the board.
Rick Ellingberg, manager of the Asheville office of Division of Workforce Services.
I'm David McLean, and I represent the Buncombe County Medical Society. Some sort of society.
Psychiatric Society. And I'm Sharon West, the Veterans Administration.
Jennifer Way, Community Care of Western North Carolina.
Stephanie Kaiser with Mission Health, and I'm the pharmacist on the board.
Winnie Ziegler, Mission Health, I'm the RN. Who are you?
I'm Don Locke. I'm a community member, retired.
Richard Oliver, veterinarian, North Carolina Department of Agriculture.
I'm Crystal Lance. I'm Andy Stone's assistant. I'm with personnel.
Suzanne Swanger, worked with the school system, and I'm the vice chair.
And I'm Nandy Sun. I introduced myself to you outside. I'm the Health and Human Service Director.
Hi, I'm Michael Frew. I'm the board attorney.
I'm glad you're here with us today. Has everyone had an opportunity to look at the agenda? In accordance with State Government Ethics Act, it is the duty of every board member to avoid both conflicts of interest and appearance of conflict. So, do we have any issues of conflict today? No? Do I hear a motion to approve the agenda?
So moved.
Second?
Second.
All in favor? Thank you. You should have received the minutes electronically. Any questions regarding the minutes? If not, do I have a motion to approve the minutes? Second.
Second.
All in
Third.
favor? In between bites, thank you. All right. Jim is out of town, so Jennifer is with us today. Which Jennifer? There she is, for our financial update. Welcome, Jennifer.
Thank you. Good afternoon.
Good afternoon.
You should have received in your board packet the year-to-date expenditures for both DSS and public health through March 31st. Represented here in the graph, as usual, you will see that there are a few of our areas where we have already exceeded the target. So we are 75% through the year with our budget. So the target for spending you would anticipate to be at about 75%. The areas that are over that are the contracts that we often pay up front. You will see in the DSS budget, the capital expenses, and again, that is a counting transaction with county finance that takes place at the beginning of the fiscal year. And in aging services, that's 100% because we pay that contract all at one time as well. All other expenditures for DSS related to operating and program are under or on target. Any questions related to DSS? That's going to be the same for health expenditures. You can see the capital expenses again at 100%, and all other areas related to expenditures are within anticipated expenses.
All right, questions? Great. Thank you very much. Lisa, you are the feature today. As we continue to go through each month and having a perspective by the staff, we're glad to hear from the Communication and Diversity Project that you're so passionate about.
And that is the truth. I'm hoping that Frank will get here because last night we had our first professional development class, and we had over 60 people that attended. So it was standing room only, and it was very exciting. So hopefully when he comes in, he can talk to that. But I am going to start out today just talking about the work of the communication team, and then segue into that Western North Carolina Diversity Engagement Coalition. And I found this quote and I thought it really summarized well what it's all about. Because at the end of the day, the impact of an entire organization comes down to each relationship through communications with the chosen audience. And that's whether it's between an employee and their supervisor, or it's between employees and a team, or people across divisions, or us speaking to the community, or trying to engage with the people that are using our services, that our currency is really all about communication. And if we don't get that right, then nothing else really works. And yet, so often, it's the one thing that gets overlooked. And it's been a remarkable experience to have developed a communication team and just see what comes out of that team and how it begins to influence the culture of our agency and hopefully our community. And that's what we're going to be talking about today. So the communication team consists of Stacy Wood, who's actually at a training today on crisis emergency communication, so she's not able to be here with us. Jennifer Johnson, who you'll hear from, Galen Ehrlichman, and Ben Atkins. And Becky's also going to be a part of this going forward, as far as she's going to be working on the internal communications with Jennifer Johnson going forward, but we're talking about the work that we've done most recently. What I love about this team is that it is another example of where diversity makes a difference. Every one of these team members have a very unique skill set and talent, and we are so much sharper and better together when we're working, and you're going to see some examples of where we start out with the product, and then through an iterative process of where we're using each other's skills, that product just morphs and gets better and better. And it just feels good to really experience that team process as it's meant to be. So our goal is always to engage, to educate, and then to get people to act, right? We want people to have healthy lifestyles. We want people to make good choices around safety. We want people to be self-sufficient. We're trying to get people to act in ways that are in their best interest. And so we have kind of this team approach where we have a communication team. On that team, there are program subject matter experts. So these are people who are representative of the different programs: social work services, public health, economic services, veteran services. And then we have communication specialists, who you'll hear from in a minute. And then we also use the community advisory group, and you'll hear how we use them to influence what we're doing and to get feedback about what we're doing. And then our community partners. We're really going to try in the next year to push our information and communication out into the community in ways that we really are changing the conversations that we're having. So the first one up is going to be Galen, and she's going to go through a chip card that we got. Came to the communication team. This was the first variant of the form, and I think you haven't. Do they have that in their packet as well? Did we get that printed out? Okay.
We were afraid they couldn't see it on the slide, so if you'll help with that part. They'll have to one of each. Well, I don't really need to stand here, I don't think. I'll perch right here instead. I actually brought a prop. Hopefully it doesn't ring. You'll see why. Okay, as that's coming out, let me introduce the part of the process that I'm going to spotlight for this. So we do have a process of working with staff who have requests and a process that we use with our team. And the slice that I'm going to cover is really how we work to define our messages, to refine it, because sometimes we start in one place, and when we get down to it, and as we drill down, we end up with some very specific things that we're wanting to communicate in whatever way that we do it. We also work with our key staff person to help us understand the population that they're trying to reach, and zeroing in. Some people call it a target audience. Some people don't like the word target in there. But who are we trying to reach out to? Who do we hope to engage? Then we want to zero in on, and when we do that, what do we hope is going to happen? What are the results of the communication piece or the communication strategies that we're getting at? And then my part is often then figuring out what is the best way to push this out once we have a product. Who do we need help with getting it out? Where is it going to be placed? Do we need to work with our major print and broadcast media? Does it just need to go on the website? You know, this kind of thing. And that's the area where we have lots and lots of potential from everybody in this room. So now that most of you all have a copy of the slide, I actually want to go to the next one, because this was a before draft, which actually looks pretty good, I think. Oops. Do we have more than that, Ben? There we go. Yes, okay. I don't really need to go through it, except I didn't want the before hanging up there. So let me just do the setup with you all. If you all take a minute to really look at the light green page, because that's the after. This is still a draft process. And we're actually not going to do a focus group here, except for those of you that can't help yourself, and if you're just like dying to share some information, jot a note on it, and then just leave it where you leave your name tags, and we'll pick it up, because we are still gathering information on suggestions and changes. But for the purposes of this presentation, we wanted to show how the process moves us from a draft to something that's more of a final draft, and some of the things that we did. So for the setup, if you were to look at this, I'm hoping that you could tell what CHIP is. So if you look at this, can anybody just kind of quickly kind of zero in on what is CHIP on your form? What's it say, Don?
Community Health Improvement Process.
Okay, and so what does that mean?
This is an assessment.
On your, just from the card, so if you, see if you can tell from the card.
It's unfair, you
Pretend I don't know.
Background information.
It
That's the wrong
probably means that we're trying to figure out what the various rubrics are for measuring healthy living in Buncombe County.
Does it say that on the card?
No?
Maybe it should.
He knows too much.
Yeah, so if you looked at this, you can see that on the front side, it's trying to say, this is a priority for us, so what are we doing about it? And when you flip over on the other side, there's a statement that really says, you know, it's how, as a community, we're working together on this. If you were to look at this card, if we had more time to study it, it's really not for the general public.
Too
So
busy.
who would it be for?
Policymakers.
Possibly policymakers. The request actually came to us to say, we want something so that if we were trying to recruit you to one of our CHIP teams, we've got a tool to help you zero in on what it is, how you might be connected to it. So if you look on the back side, it gives a summary of some of the things that this group collectively is working together on, and we would recruit people for that. And there are other parts on there where you might be able to go, well, I might like to join in that area because I'm doing that. I want to see what they're doing. And so that was the intent of this card, is to be a tool for the people that are already involved in the CHIP process. And without going into too much, we just kind of land on that it's a tool. So the process we use for before and after is something that we do with every campaign. We actually start with our expert to say, let's list the key information. Let's list the people that we're trying to focus on. Are we joining in with any other campaigns? And we're really kind of distilling it to some things that make sense for everybody, so then we can make something like this. We could write a news release. We could talk to somebody. These are our talking points, actually, and how do I talk about this thing that Dawn said? I think it's something with metrics, and you know, how are we all going to talk about this thing in the same way? This is the answer to that. And so the first thing that we did when they came to us is, since this isn't just a health and human services program, this is a program where the community is coming together and we're leaving all of our agency logos behind, right? So mission doesn't get theirs on there, and the schools don't get theirs on there, and health and human services, but they wanted a branding opportunity so that no matter which CHIP team or whatever communication was going off, if it was related, you'd have an identity. And so this team actually worked with them to come up with this logo, which was, the basis of it is how geese fly efficiently and work together, is that they have a lead and they fly in formation. And the cool thing is the lead can shift depending on if they're getting tired or if they change directions or whatever. And so that's what that logo is. It's for people working together in an efficient way. just in case you wanted to know.
And Galen, I'd like to make one point. It absolutely is a recruiting tool, but then the other kind of subtle request that was in that was for those of us that are sort of agency reps on different items, to have a tool that we can take back to our colleagues, because just like trying to communicate that within your services here, we have the same kind of challenge of, this is the thing we're working on, this is why it matters. And so things like this that are in the sound bites and snapshots really help with furthering that understanding.
So it is a sort of that tool, but it helps everybody talk about it in a very similar way. Even from one team to another, there's 3 teams, and each team got a different color. Healthy living is green, and early child development is yellow, and preconception health is purple. Anyway, so those were some of the tips. So some of the other things that we did as we were changing, if you see the darker green one was a draft, and it was only supposed to help us with the key information. So then we can take that and do some of the sort of translation into something that's easier to read. And so you hear something about plain language often with clients. Plain language is just as important for any of us. And plain language means that we're trying not to use jargon, and we're trying to not use acronyms, except CHIP, right, which is well explained. And then you don't want too much dense text. It's good. We're going to bullet it out. And for the graphics, make them as easy to read and to interpret. And so those were the things that we did. And we also rearranged some of the material for the flow. And then one of the big things that we did on the after one, down at the bottom where you have the contact information, it used to say, we want to engage you. And we're like, well, what would that look like? And so to engage, we worked with the staff, and they were like, well, we would want to be able to invite them to a meeting or get them interested in the advocacy priorities or this. So we made a little checklist on there. Not that somebody would actually check it and give it back, but those are prompts to the next action step. It could be, if they checks it, a kind of a commitment. I want to come to the next meeting. Or yes, please have Terry call me and let me know when the next group meeting is about healthy foods or access to healthy foods. So those are the things that we consider. We also really thought about the tool and how to engage somebody. And the best thing is that we can do with any of our materials is to take a moment, even if it's running it by this group today, and say, quickly give us your feedback. It's field testing. And we field test our products wherever possible, even if it's running it by a few people, so we can get the end user's feedback. And we were able to do this with the chip card a couple of weeks ago, and that's why I've said the light green one is not the final draft. It's very close. But we were able to give it to the CHIP members at their annual meeting and get lots of other refining kind of feedback. So then that'll be the next iteration. And for those of you that are on the Public Health Advisory Council, it's going to roll out then. So we'll give it back to the CHIP folks, they'll see it again, and then we'll refine it. So that's a little bit of the insight there on how we take it and hone it down, and we do that with all of our products. I just want to say another aspect of what I do, I'll bring to the team, has to do with how we roll it out. And so we have made a commitment that we will increase communications to our Buncombe County contractors, and we've done that with our campaigns. We share that, we share how they're supposed to talk about it. We're sharing it with our emergency assistant partners, we're sharing with libraries, and some others. What we want to get better at in the next year is those of you in this room and some other real key partners really partnering together to saturate some of the networks that we share. And so in doing some of our campaigns, it's not just a pamphlet that we send at Health and Human Services or that we give to a staff person. Sometimes it's a complex campaign that involves also doing a news release, putting it up on the ad, maybe doing radio commercials, and paid ads in some of our lesser expensive publications and very focused kind of publications. And when we do that, that's where we get into the realm that I won't go into a lot, but it's what we do with the television, newspaper, radio, whether we're on the talk shows or whether we're responding to it. And so this is our media phone that I carry, and also Lisa, and I'm trying to train her to say this is called sharing the love, not other adjectives we might want to say, but we have a policy to respond within 15 minutes to find out what they're doing, and then we can put it together. And my link back to this process is the same thing that helps us in defining those key messages, those real specific talking points, is the same thing that helps us here. We're on to our key messages, we're on to those specific talking points. They get refined depending on if it's sound bites for TV or 30-minute talk show for a radio. But it's the same thing. A lot of our work is just refining and getting that, and then it's easy then to reinforce it no matter which way we go. So, and actually, Stacy isn't here because she's at a training to learn to be a public information officer. So we'll continue to share the love. I'm really excited about that. Any other comments or questions?
I like this, Gayla. I was looking at the highlights of the healthy weight, physical activity, nutrition, food security. And when I look at healthy weight, I'm like, wow, that's not good. When I look at nutrition, I'm thinking that's not good. Food security, that's not good. But physical activity, over half of residents get 30 minutes of physical activity, I guess, per day.
Yeah.
I'm not sure.
There is a
but
definition.
is that bad?
Is that bad?
The recommendation is 30 minutes most days of the week, so we got a negative, a positive, a negative, a negative, so.
Our positive means we're going in a positive direction.
Right.
And I think when you compare to others, this is just all I can remember from my community health days, community health assessment days. But you're right, I mean, I think that this is just where we're at right now. It's a snapshot.
I mean, I think it's good because it heightens our awareness, but I'm looking at the drop. I read this, I'm like, wow, what can I do to improve this? What can I do?
Well,
30 minutes, that's not bad.
Because
so
that was supposed to help us know, why is this a priority?
Yeah.
Because we're not doing so well. We can do better. And the people coming together are saying, this is what it's gonna take. These are complex health issues that these chip things are all about. Okay, I'm gonna get off.
Galen, it brings a world of talent to this position that we are very fortunate to have, and the media is a huge part of that as well, just handling those calls, getting the talking points. And having carried the phone, I know I call it an anchor. So. And next up is Jennifer Johnson, and Jennifer's been with our team for about a year, right? So she's going to talk through some recent work that she had, and you guys have these in front of you, as well as behind you. You have T-shirts that Ben designed the logo for, and they're for you if you want to pull them off the back of your chairs.
So I'm Jennifer Johnson with the Health and Human Services Communication Team, and April is Child Abuse Awareness and Prevention Month, and the communication team has developed materials around this topic, including the T-shirts and the rack cards that are at the table. We focused on 3 areas of prevention that are most likely to result in cases of child abuse and neglect. The first one is shaken baby syndrome. The second one is sudden infant death syndrome. And also the third one is the importance of knowing your caregiver. Knowing who you leave your child with is particularly important because we know that almost 84% of inflicted injury, death, in child abuse cases was caused by the non-biological caregiver that resides in the home. And only 6.5% of child abuse was caused by the biological parent. This data was published in the official journal of the American Academy of Pediatrics. In an effort to reduce child abuse and neglect through education, we've developed these rack cards and screensavers. This is the first one that we tried to develop, and then I'll show you the final one. So we use design strategies and messaging techniques to design these materials, and part of our design strategy is to use simple, clean design with vibrant and complementary colors, easy to read font types, and that we use consistently in all of our materials, and we try to include as much white space in between bulleted information to make it easier to read. And branding, and we typically use our Health and Human Services logo, but in this case, we're focusing on child abuse and prevention, and that's part of the Under 6 campaign, which is the orange hand on the shirt and also on the rack cards, that logo. We also use the tagline on the rack cards, "Good parents are made, not born," and that ties into the Triple P program, which Deanna Lamont coordinates. Messaging techniques include providing simple steps in plain language with words that are easy to understand, and we typically try to use language that's between the 6th and 8th grade level or below. We use a variety of assessment tools to determine the readability level, and I think Galen, she mentioned that earlier. So, and we also try to use short taglines that are easy to remember and that catch the attention of the reader. Larger font sizes as well on headings and like for the phone numbers or contact information. We try to use larger font sizes for that. So to help our staff understand the Health and Human Services brand, we have developed a brand manual to help them follow brand guidelines, and this reinforces the power of our messaging that we put out in the community. And I hope that you like the work that we're doing, and thank you for your time.
Did you use a focus group with some people who may have been in these situations to look at these cards?
We actually took them out. There was an event on a week ago Saturday that Mission Health sponsored and we brought them there, and they had some feedback on the cards as well. So what I've learned through communications is a continual iterative process, and that you just keep getting feedback and you keep making it better and better and better. And you know, even when you look at what Jennifer said, like this was the original screensaver she put up for our internal staff and on the lobbies, and I said, whoa, too much information. And so the team went back, and then you see they cleaned it up. We got feedback on those cards about the who you leave your caregiver with. That one of the things people had was the thing about not using tobacco and drugs, and they said don't do it around children. Like maybe they won't totally give it up, but they know not to do it around children, so they wanted that added into there. So, did you have other feedback, Don?
No, I just thought
the community advisory group will look at these
they're
again.
very attractive, but I think that the type of message that appeals to, I don't know how to say this, I'm getting deeper in my.
Well, to the general public.
To the general
To
public.
us versus
Yeah.
to the person that this really will mean something to.
Yeah.
Who really
Thank
may
you,
be
Stephanie.
sitting on the edge of that cliff.
Or
So-
with whom we may have had some involvement in abuse or something of that sort. That's
I think it's a really good point. If you go back to when we first started the Undersix campaign, and Angie can weigh in, we actually hired some outside consultants and looked at some evidence-based materials. Child abuse and child abuse more than neglect is one of the more difficult areas to do communication,
Right.
either to the general public, because there's only so much I can see and comprehend,
Right.
and then how you also deliver the message to the targeted audience. So we did do a lot of research to begin with before Lisa's team took it on with an outside consultant
And we sort of started off on the wrong foot, actually.
Yeah, way on the
It's
wrong foot.
counterintuitive to what you think it should be.
Well, if you look at this messaging, it's very clear about the steps that you have to take. You don't have to guess. It's clear messaging about what can make a difference. It takes away all the other stuff. We're not focusing on people that kill babies or hurt babies,
no.
because that's exactly what people don't. They go, I don't want to hear it. It's too much. It's too painful. And so, but the Community Advisory Board reviews all the materials that we have before we go out with them, and they oftentimes set us in a different direction as well. So, and Ben's going to talk next actually about some input we got from the Community Advisory Group, so it follows in quite nicely.
Hi, everybody. I wanted to show this. This is what we're going to show here is a video that was created from input from the Community Advisory Committee. The committee meets once a month, and it's an incredibly diverse group. A lot of different people with a lot of different backgrounds, bringing a lot of good feedback to us, and really opening up. It's a very interesting group to meet with and to spend time with, because they really feel it's a really sharing group, and they have a lot of good input. And we talk to them about a lot of the different things that we've developed. And one of the things that we wanted to show them was our website, because it's a huge website. The county website in full is over 2,000 pages. That is a huge amount of information. And what we wanted to do was to try to get people to understand how to navigate the site, find information that they're looking for, and be able to understand the information that they're developing. So the first thing we did was we asked them to find the website. And we used some scenarios to sort of describe a situation of a particular person that might be looking for something on our website. So say a single mother who's trying to find out information about WIC. So we sort of put the sort of perspective in their minds and asked them to go to our web to find out information about WIC on our website. So we had them go to Google and type in what they thought might be a good way to find our website. And what they found was that they had a lot of trouble just knowing, what to look for. One of the big things, one person described that they had trouble spelling the word Buncombe. They didn't know how to spell it, which, it's not an easy word. It's a difficult word, so that was one issue. Another one was a person looking for assistance, and they were looking for public assistance, but instead they put in the words public. It was public. I'm sorry.
Service.
Public services. Yes. And when they put in public services and searched under that, they came up with the city, and the city has different services that they provide. It wasn't what they were looking for. So one of the things is we wanted to do was develop a video that, first of all, we talked to the IT department and asked them to help us with search engine optimization, which is a way to go in and define some keywords and things when people search so they can find our website and they can find the information that they're looking for. So we did some research into that. And then we decided that one of the things that would be very helpful is to have a video on the webpage that explains how you find things on our website. So here's the video that we produced with input from the Community Advisory.
Welcome to the Health and Human Services home webpage. From here, you can access information about the different programs we offer. HHS programs were designed to connect you to all of the services you need so you can get back on your feet and maintain your health, safety, and self-sufficiency. Our services include public assistance, public health, social work services, and veterans assistance. To learn more about specific services that are provided, click on any of the program areas in blue to the left of this video or below. You can also call 828-250-5500, or you can visit our main location at 40 Cox Avenue in downtown Asheville, across from the bus station and post office. If you find that we don't provide all of the services you are looking for, you can click the 211 icon on the bottom right side of the page. To search for services on the 211 website, click on the 211 icon and choose one of the categories. You can also grab your phone and dial 211 to be connected to someone who can help you locate services offered by other organizations in our community. Buncombe County Health and Human Services, bringing good choices within reach.
So it's a very simple, short video. It gives a basic overview of how the website, navigation of the website works, and how you would find information on the website. But it also promotes other avenues for finding out information. Calling the phone number for Health and Human Services so they can get more information that way. Or in particular, contacting 211 if they're not finding the information that they're looking for. they can contact 211 and they can share a lot of different information with them that we may not have direct access to on our website. So, yes.
What about a person who is Spanish speaking who goes initially to the first screen?
Uh-huh.
What do they do?
There is on our.
Well, I saw way down at the bottom at 211 there was a reference to a link, but I'm thinking when you first go, there ought to be something that says if you want Spanish, go here, so they don't have to go all the way through it looking for that Spanish thing at the bottom.
And
It's
I
down
agree,
at the bottom there.
Right, down at the bottom it does say that interpreter services are available. We currently do not have a fully translated website. The Register of Deeds has developed a section of their site that is translated into Spanish and English, but the entire site has not been translated. There are tools that people can use to translate information on the website, but it hasn't been done by the county at this point.
I would suggest then that you tell people that at the first slide so that they know that this is not going to eventually erupt into a Spanish, say it's under development. Because I think we want to be able to communicate to all of the people. And I think that my understanding is Buncombe County is very user-friendly with Spanish and even with Russian.
That's
so
right.
we need to say that to people early in the presentation.
Okay, I think that's very good input. It's one of those things that we try to work on because the site development is constantly going on, and we're constantly talking with the county IT department and developing new ideas and new concepts for the site. There's actually a new site that's being developed for the county right now. So this kind of input is really good because we can share that with the web department and talk to them about how we can develop.
My understanding is that 211 has a Spanish-speaking person on at all times. That might be one of the ways to direct them, to direct the user.
That's a very good point.
Philip, do you know what percentage, you have bilingual staff in the call center too? You basically recruit for bilingual in call center, front desk,
And the greeters as well.
And greeters. But I think that's great input, and I was asking, Mr. Fruit, the attorney, I think on the Health and Human Services side, you could argue their Title VI issues if they don't address it on the web. So maybe we can push them on that.
Well, it's all about access, and if
Yes.
we can be customer friendly,
Ben,
how to
let-
get access.
Just one comment, this may be really off the wall, but one of the pictures you showed of the Health and Human Services building, 40 Cox Avenue, showed a picture of the sheriff's car. Now,
Good point.
you can look at that one of two ways. If I'm a user, oh, that's a safe place to go, there's a sheriff's presence there, or do I want to go there because there's a sheriff?
That makes a very good point.
So,
Different
I
perspectives
just,
there for sure.
you know,
I think the parking of the car here is very intentional. I think putting it on the web is a really good point. Take a picture that's different than that. Security in that building
I know
is a
there's security
daily
and
event. But I agree that we should change that on the web. Take one when it's not parked there.
It's funny because when I saw it up there, this is the
I
first
thought
time
that.
we
I
just
thought
did
it
this,
too.
and
I
I
thought
thought
it
the
too.
same thing, so especially if you're a Spanish-speaking individual, you might feel differently about
That's
it.
a great input.
And we just had a session when the man was here speaking about security in department stores, and someone said that police for them represented security, and there were like 5 people in this group who are adult, law-abiding citizens who said, I still don't feel secure when I see a policeman, I'm frightened. So I think that in essence, what you're saying is true, that everyone doesn't immediately say, oh, that guy's there to protect me, that guy's there to arrest me for something, or I think that we have to,
All of that's good feedback.
yeah. It's wonderful, though. I like the content of it, I like the ease of it. It seems user-friendly to me. And I noticed that Stephanie was going right along with you over here, so I was watching on her computer so that I could see what was going on
Was
there.
it easy
So-
for you?
I always got in trouble for looking ahead. But no, it was, and it was, you know, and then on the other pages were some of the messages scroll.
Yeah.
Those are really nice, and I can see the theming that you were talking about in terms of the brevity of the message, very clear, direct, of what I'm reading and then what I'm directed to do. Really well done.
I really like the simplicity of it. Most websites now are so so busy.
Right, there's a lot of
There's so much stuff there to distract, that this was very simple. It showed exactly what you wanted, and that's what you want people to focus on, rather than a nice picture of something.
Yeah, great, thank you. The video itself was done in cooperation with the county's TV station, BCTV. We sort of developed the concept for it and did a draft video of it, and then they made it look nice and all the neat little things that we couldn't do. So they did a really nice job on it, and we appreciate their help. The next thing I wanted to show was this is our latest annual report. Many of you have probably already seen it. It was developed, a lot of good input and information shared from all different groups throughout the county, including the advisory committee, also with our communications advisory team that we have that meets every week. And every other week we have a larger group that sort of reviews these kind of things, and that was a great bit of input. And I wanted to see if I could engage you just for a moment, because we are actually developing something for our foster care program. We're trying to put together a new logo for them that they can use in their promotional materials, and I wanted to get your feedback on that. Now, I wanted to sort of get a little bit of your perspective from the kind of feelings that you get, because that's sort of what the Community Advisory Committee does. When you look at this logo, there's usually a guttural reaction. You either like it or you don't like it, and you can explain why. You're down on it already. But when you look at it, you also want to get a perspective of how it personally makes you feel. Like what pops into your mind when you see it? What's the first thing that makes you feel? Does anybody have any of that kind of perspective when they see this logo? Nurturing.
I'm thinking about a community garden,
Community garden. Okay.
not thinking about a child.
I'm thinking of Fuster, not Foster.
Buster.
I did.
Okay. Yeah.
The first thing came,
That O is not quite
that O is
done.
not
Not
quite
quite
there. And I was just trying to figure out if you could move the circle up a little more and down to the sides. I think you might do it.
You're going to have a similar reaction to the next one. So anybody else have any feedback that they?
The color,
The colors.
the color of Foster, it's an off-putting color to me. It's sort of depressing.
Okay.
It's not
Yeah,
bright. It's not bright. Like
It's
the
not
green
bright.
is very
Yeah.
nice.
It's sort of a bit of a darker color.
I have the same reaction to the next one.
Okay. So
Ready?
he's ready. You ready for the next one? Here we go. It's the same.
Oh.
Oh,
Very
no.
simple.
No.
When you first saw
Is
this,
this the man in the moon?
poor Ben.
What is this? What is this supposed to be?
Now,
It's-
somebody spent some valuable time.
It's okay. That's
It's
okay.
I think they
It
had.
really is right. No, what it is you're seeing the silhouette of a person looking up at the stars. And the idea
It
is,
looks like Richard Nixon to me. That's
okay.
literally what I thought of when I looked at Richard Nixon.
Okay, that's fair. I appreciate the feedback. I will take it back to that. That is very useful. I appreciate that. Thank you.
So you can see just from this little exercise that you have to have a pretty thick hide to be on on this team as well, because we get that kind of feedback, and then it's back to the drawing board. And Ben worked on one project. Remember, I'm trying to remember what it was, Ben. It was the EPAS project, and it just totally, we threw it out finally because it just doesn't work, and that's part of the creative process. So thank you, Ben, for doing that, and thank you for participating. I love how the communication team also fosters. You know, we're trying to develop an organization that's a learning organization, and our team is a learning organizational team. And we have to have really thick hides, and we have to be open to hearing different perspectives, and we have to be able to change what we do because of that. And so it's actually a great microcosm of what we're trying to do. So I'm going to pivot now, and I'm going to talk about some of the science of communication. And I normally, when I get ready for a presentation, I throw everything up, and then I have a lot of time to kind of go through and get rid of some of the stuff because I end up with too many ideas, and unfortunately I didn't have as much time to do that today. So put your seatbelts on, and we're going to go through some of this research, but I find it really fascinating, and I wanted to share it to you because the graphics and the pretty rat cards are great. I mean, they're important, and I don't mean to underestimate them or trivialize them, but they're just the beginning, and they're just the jumping off point for the kind of conversation and communication that needs to be happening. So here's the reality of our worlds right now is we are just bombarded by information. I mean, it's coming at us constantly, and it's a matter of, it's within a blink of an eye, anything that we want to do. And because of that, we really have to figure out how to sift through the information, and we have to create frames that allow us to ferret out, this I need to pay attention to, this I don't need to pay attention to. And those frames can work very well and effectively in helping us navigate our day, right? Because there's so much going on, you've got to find some way to make sense of it. But on the other hand, sometimes they can cause us problems because the frames really frame how we see reality, right? And in communication, we're trying to make sure that we get through the way that people see reality. We're trying to intervene into their frames. And we know that people use these mental shortcuts to make sense of the world, that they have to have them in order to be able to take care of that deluge of information. And then we develop these habits, right, and patterns of how we see the world. But these habits and patterns can sometimes become like a force shield against new learning, because we use these frames in such a way that we only let in the information that already doubles down on what we believe, right? And the information that discounts what we believe, we tend to throw out, we don't pay attention to. So if you're trying to get people to look at things differently and see things differently, you've got to find some clever ways to get through those frames that they have. Does that all seem pretty clear? And then you've got the media who's constantly doubling down and choosing what frame you use to look at things. So I didn't want to put this up here that vaccines cause autism, so I thought I'd put on the different one because I'm trying to counteract what's in the media, okay? But we know that there are themes in the media today that we have, that autism is linked with vaccines. Doesn't matter that there's been a bazillion research experiments that have proven that not to be true. We have myths about welfare queens, right? We have myths about the continuation of welfare, even though it's changed since 1996, sorry. So the media creates these frames that we're trying to filter this information. We also know that communication resonates with people's deeply held values and worldviews, and that it's really about these values that oftentimes are what hook us into paying attention to something. And values are also inextricably linked with our identities, our self-identity. So again, if we find information that's coming in that's going to rattle our self-identity, we're more likely to not pay attention to it, right? But if it reinforces what we think we are and what we value, we'll pay attention to it. And then when communication's inadequate, we default to those quick knee-jerk pictures in our head. So that's what we're going to go to. But when it's effective, we see an issue from a different perspective. And I'm going to show you in the next slide a work of art that's been broadcasted lately in the news that is a perfect example of how we can use the deeply held values we have and then a different context to have us look at something differently. Has anyone been aware of this? Have they heard about this in the news? So this is an artist out of Canada that developed a sculpture of Jesus. And if you look, you can see the holes from the crucifixion in his feet. So our deeply held, for many Americans, Christian viewpoint about Jesus, deeply embedded in a lot of how Americans identify themselves and people across the world. And then he has placed this within a context that forces us to create a different frame, right? So we're looking at Jesus as a homeless person on a bench. And we're trying to get people to have a different way, an opening in their brain to look at the homeless population differently, to relate to them, to see them as a child of God. And this artist has done an amazing job using art and communication in a way that gets you to look at things differently. And these are just, there's a bazillion pictures on the internet of different people who have responded emotionally to this sculpture. So this is really important. There's a whole industry about Frameworks Formula, and it's a science of how you message things. And what they say is that you need to lead with shared values, a shared vision. So there isn't a person in this room that wouldn't agree we want all children to realize their full potential, correct? Is there anyone who would disagree with that statement? That crosses all political beliefs, all spectrums. We can all agree that's a good thing. So we lead with that shared value, and then we pivot to the problem, and then we create solutions. And oftentimes in health and human services, we're trying to create solutions that are about individual choices, but also about a system that supports those individual choices. And that's in our messaging and in our branding if you look through these materials. We looked up how to pronounce it. Go ahead, can you say it for me, Don?
Phenomenology.
Thank you, phenomenology. We were doing the Google audio on that one before we started here. But it's the study of how people experience life. And this is another aspect of that science of communication that's kind of interesting and very relevant to what we do. There was a study that was just out of the Harvard Business Review Journal, and they talked about this this company that did the ileostomy or the colostomy bags for people who had surgery, and their sales had flattened. They didn't understand why, and so they actually sent social scientists and anthropologists to go live in the homes of people who had these colonoscopy bags. And by doing that, they were able to directly observe the facts. They were able to look at the habits and practices that informed their behaviors. And then they could peel back and see the underlying causes of those habits and practices. And what they found out is they had been surveying their people that used their bags, and they'd all said, yes, it's fine, it's all good. But when they went and lived with the individuals, what they found is that the people's lives had gone from being this broad and going to this many places down to where they were living this life that was like this far from a bathroom, because they didn't want to ever be embarrassed by an accident with the bag. And their lives were totally different. But when you asked them if everything was fine, it was fine, but they had crafted a life that was very narrow and different. In addition, they found that the bags that fit on the perfectly sized mannequins that they had in the factories didn't fit in the different kinds of morphology of people. And so they changed the bags, and they found out a lot more information. But how is this relevant to health and human services? Well, we need to be aware of the people we're serving and the habits and practices informing those behaviors and choices, so we can intervene in ways that really create different actions, again, ones that foster health and safety. So there's a new book out called Scarcity. Has anybody heard about it or read it? It's a great book. And I'm not going to get into it today, but it's a really good book if you haven't read it. But it talks about how when you're in a situation where you're in poverty and you're trying just to get through the day between one decision after another, your scope, your ability to see things gets so narrow that all you're focusing on is where you're putting your next step. The fact that bill's due, but you don't have the money, and you know that it's going to cost you 10 times more if you don't pay it, you can't even pay attention to it because your scope of vision is so narrow that you can't see that. The authors liken this to people who don't have enough time, and they try and create this empathic bridge so that people can understand. Again, much like that picture of Jesus on the bench and trying to get that compassion. But what we want to do in communications, and Ben pointed this out to me this morning, was we really want to get into this picture right here. We want to be able to get in their narrow vision in a way that they'll pay attention to what we have to say, and they'll make better choices. There's another man named Fogg that has done this research, and he has really looked at how you create good habits. And so again, we're trying to change what people do. And he says that you start small, you find an anchor, and then you celebrate. Okay, and so we're looking for those anchors in our consumers' worlds that will help them make better decisions. And we're trying to help them find ways. And we're using community service navigators and the community advisory group in ways that we can find that we can anchor these small choices that end up making big changes in their lives. But you got to be clever about it. I actually started Fogg's thing. I thought, okay, I'm going to do this experiment, and I cannot do push-ups, and I wanted to be able to do push-ups. And so I started out, and I've been doing it I started out doing 2 little knee push-ups, just like that lady. And it's been 3 or 4 months now, and my anchor is brushing my teeth. After I brush my teeth, I do my push-ups, and I'm up to 15 push-ups. And you start out so small, you can't say no. You know, it's like, I knew I couldn't say no to 1 push-up, okay? Like, everybody has time for 1 push-up, right? So it's science. It's science of how you change action. So this year we're going to focus on 2 areas in the communication team, and the one is on improving the immunization rates in Buncombe County. And this is data hot off the press, but you can see Buncombe's in the red, and it's not looking good for us. That's the opting out for immunizations in our community. And it's herd immunity is at 4%, 4.5%, is that about right, Gibby? And we are at that point where we're losing our ability to have herd immunity, so that outbreaks are much more likely to happen in our community. So we want to focus on that this year. But interestingly enough, did any of you all hear recently that there was a thing on NPR where they did research out of Dartmouth, where they actually went to people who, they were trying to increase immunization rates. And so they went out and with 1,700 parents, they gave them information about the pros and cons of immunizations and why it was safe. And what they found is that when they surveyed people afterwards, everybody agreed, yes, they changed their ideas that immunizations were safe, or it bolstered their ideas. When they went back and looked at the people who didn't want to immunize their children, they found that they actually were less likely to now immunize their children. It actually had a boomerang effect. And the researchers were trying to figure out, why is this? Well, you remember a few slides back I talked about how we have deeply held values or beliefs that are tied up with our egos? And they really believe that for people who don't want to immunize their children, that it's deeply tied up in who they see themselves as and how they relate to the world. And so by trying to break through that, you actually cause a doubling down on that belief. So I just put this out here to tell you that this work is really complicated, and that it really requires us to read across a lot of different disciplines and then inform what we're doing in ways that really help us. The researchers were saying if you boost people's self-esteem before you give them this information, that it will actually soften them to be more likely to pay attention to it. So what we've decided to do is not focus on the people that don't immunize in our community. Over the next year, we're gonna really double down on focusing on caregivers who do, to help make them more educated so that their voices rise up over the people's voices who don't want to immunize. We're gonna focus on educating kids so that kids understand from an early age that it's important to be immunized and why they're getting immunized, so that that will become part of a lifelong habit for them as well. And then just raising the voice throughout our community through that distribution list like Galen was talking about, so that we're changing the conversation and what's getting listened to, that we're counteracting what's happening in the media with information that is good for us and within our community. The second focus is on child welfare, and we're really gonna get messaging out about that not having children left with people that you can't trust them with, because we know it leads to child morbidity and mortality. And we really want to focus on this is engaging the community in different ways that they can offer child care services, or inspiring churches and different community centers to provide more options in addition to caregivers making good decisions. We want to have our community engaged in a conversation about good options for people. The Circle project that you guys heard about last time is another effort where we'll have more options around child care. And so this is, again, trying to weave ourselves deep into the community in ways that we know will make a huge difference for the children in our community. And that's just what I think. So any questions about that science of communication? There is just so much research out there, and for me, I find it really interesting. I don't know if you guys find it interesting, but it's fascinating to me that you can't just assume that this is gonna do what you want it to do, and that you really have to peel it back and look at it and ask deeper questions. So, yeah, Don?
There are 2 bits of information that I think are useful to you. Research says that we communicate with the total message that we communicate with, 7% of that is verbal, with words. I think it's important to remember that as you think about how we hear things. We hear it with 93% of other factors, most of which is emotion. And I think that's where we are now in relationship to politics and things like vaccinations. The other thing is that someone just told me the other day that the threshold around which people take action is after hearing something 12 times. Now, I haven't read that, someone told me that, but that you have to hear it 12 times, which is why politicians keep running their ads over and over and over, because they believe that the 13th time we're gonna vote for them. So those are 2 additional bits of information to add to your consideration.
It's very important information. And the other thing with that doubling down on the messaging and over is to make sure it's clear. Like, you can't do everything. So like with the Child Welfare Project, we're trying to just really get the information out about a caregiver. We're not trying to get it confused. We're trying to just keep it simple, and then again, repeating it all throughout the community. Exactly right.
Someone said to me, this is not research, but someone said to me that there are many people today who no longer pay attention to facts. That we are in a, now this is not research, this is one person's opinion, that people aren't convinced when you present them with facts, because everybody has their own facts now. You know, that's the other piece of that.
Well, that's that whole confirmation bias kind of thing too, that you discount anything that's gonna go against that deeply held value, which is the emotional part of the message, So I'm going to pivot now and talk about the Western North Carolina Diversity Engagement Coalition, and Frank has been a very instrumental part of that group. And as I said last night, we had our first professional development class. We had over 60 people there. It was a huge success with people. I mean, it was such a wide spectrum of people. Frank, you want to say anything about that, or?
Yeah, I had a stand. It was that full, the room, and it was amazing because the 6 anchor institutions had representation, all of them. And so this is just an example of collaboration that has been going on for a year, literally, because it was a year that we started with Dr. Livingston, and just the success that we've been able to get and engage people, to have 60 of them coming, and the results were just outstanding. The evaluations were great, and you know, when I was dropping my kids off this morning at school, and was like, I saw you last night, I can't wait to go next week. And this is a woman that I'd never met before at my kid's school. But now I know who she is because I met her last night and I saw her. And you start making these connections, and ultimately that's what it boils down to, is just connecting our community more. And that's just been the biggest part of it.
It's exciting. It was really exciting to see such energy and to see, it was just I mean, we had people from so many different backgrounds in that room last night, and it was nice to see it.
For what it's worth, I really like that design in that one.
Well, we've been working on that.
That is nice. Really, that.
I like that. I like that one.
Does that one work?
That one works.
You don't see Richard Nixon's face in that one?
No, I see a bunch of kids playing Ring Around the Rosie.
So we're Frank, feel free to chime in. We're focusing on 3 areas in the Western North Carolina Diversity Engagement Coalition. And the first one is social and professional networks. And Frank is actually chairing that. And I don't know, you want to talk about that?
And so the intent is, we want to be very purposeful. We want to create a support network so that people can engage on a professional level, but they can also socialize and have a sounding board and just an informal way to communicate and socialize and build up, once again, a larger, more connected network.
So this was an event we held at Tresses. That was like about 3 weeks ago, something like that. And we had over 75 people that came. They were all dressed up to the nines. They had a great time. It was fun. And you know, again, like Frank says, then you see someone there, and then Asheville doesn't seem so spread out. We're 91% white in Buncombe County. And so we're trying to create this tipping point, this critical tipping point where multicultural professionals can come together and see each other and create a community that's supportive. We also have under development this website that Frank can speak to. I just wanted to give you a quick preview. It's almost up and running. It is a place that we hope people can go to where they can get connected to mentors or sponsors, that if they want to know, if they're thinking about moving to the area, they'll have information about how to get connected socially. It'll have events. It'll have some blogs on leadership. It will talk about leadership classes that are coming up. And so this is getting ready to launch. And do you have anything you want to say about that, Frank?
It should be up and running within a day or so. And it was interesting in the development of this, because when we were talking with the website developer, they were like, you have to develop it on a model called Squarespace, because that model is what functions on smartphones. And when you actually do the research and the group of people that we're trying to reach out to, utilize smartphones a lot more than a laptop or an independent computer. And so we were very purposeful about doing this, and it's going to have a lot of facets. It'll have that calendar so you can go to it. It'll have articles that are related to the professional development class, and it'll be a way of just linking everything socially, so Facebook, Twitter, and engaging people more, and ultimately developing better relationships.
And then the last one is the professional development. So there's our friend Frank.
That's a very serious conversation, but
She was with another employee, but actually this is an employee that Frank's has developed a relationship and he's mentoring, and so it's great. And I'm sure that this employee's mentoring you at some level as well. And that's part of the beauty of it. So the professional development series, what we heard from employees across these anchor institutions is they wanted development, they wanted advance. So the professional development class kicked off last night. It's an 8-week course. It's, and like I said, it was standing room only, and it was a really great night, and I think people left feeling empowered. It felt really good. We're going to be involving management from the 6 anchor institutions in this course toward the end of it, and hopefully with that we'll create linkages for better mentors and advocates for the employees as well, and that will be fostered as well and doubled down with the website. Because we know people get jobs because of who they know, and we know that people get promoted when they had opportunities to shine, to get in front of people, like a board like this, and that's what we're trying to do. We're trying to be intentional about that. And then the last committee is the Practice and Standards Committee, and that's really trying to develop a roadmap for organizations who want to foster a supported and fully engaged workforce. We've had a lot of people that want to join the coalition, and we've kind of said, no, not quite yet. We're trying to get our ducks in a row in a way that we really have something we can offer. And so part of what we want to say is what are those key elements that are really important, that really make for an inclusive work environment, that really help a work or an organization to capitalize on the capacity and the talent that they have. So that's the other part of it. I'm going to go through this really quickly. This is the whole idea of sense making and how we read into things, the meanings that we wish to see, that we vest objects and utterances and actions and so forth with these subjective meanings. And why is that important with WNCDEC? Because as I get deeper into this work, the more I realize how different we approach the world, and how whether you're part of the dominant people that are in an organization or you're not really can influence how you make sense of the world. And that to pretend that that doesn't exist isn't going to help out any of us, and that it's important for us to actually kind of bring light to that and to understand it so that we can deal with it effectively. There's a concept called attributional ambiguity, and it's this concept that describes the difficulties that people who are in a stigmatized or negatively stereotyped group have in interpreting feedback. And there have been several studies that have been done, and what the studies show is that if you're given negative feedback by somebody from a different race, and you're a minority race, you are most likely going to default to saying that's discrimination. That you're going to, because you're already in that stereotyped group, you're going to assume that that feedback is coming in a way that it's based on some form of discrimination because you're part of that group. And if you think it's just specific to a minority population, it's not true. The same thing happens for women who are very good-looking women. And if you give them feedback that says, oh, you did a really nice job on that, women interpret that who are good-looking because of their place in society as, you want something from me. That they don't really believe that it's coming from a place of authenticity. So it's kind of this complicated mix that you have to understand when you're dealing with this, so that when we do a course and we talk about a new report that came out of the Harvard Business Review on finding the coaching and criticism, and they talk about truth triggers, relationship triggers, and identity triggers. If you don't know about attributional ambiguity and you don't know how that could possibly influence what's going on, then you're going to be not peeling back the onion enough to really get at it in a professional development class in a way that's real, in a way that helps people develop the skills they need to navigate situations, to ask questions about that allows them to test reality, and for supervisors to understand how other people might be approaching that situation. So we're trying to just create that enough space for us to have enough insight that we do things differently. I don't know if you guys have heard about this Joshua Bell, he's this amazing violinist. He decided this experiment. He went into a subway in New York with his 3.5 $1 million violin, put a baseball cap on, and he played. And he had 1,000 people that walked past him, and he earned, I think, $38 that day in tips. That's all he got. He usually gets multi-millions when he performs. And the point of all that was the frame was wrong. Like, he didn't have the right frame for people to even appreciate and stop and understand who he was. Well, our employees are the same way, and we hope through professional development that we give them the frames, the tool for them to be seen in a way that we fully realize them. And we want to create leaders who are fluent leaders who really innovate in how they think about managing people, and they free themselves from these prejudgments, and they become more curious, and they create greater space for insight, and they have conversations that really allow people to show up and give their best. So that's what WNCDEC is about. So that's all I have. Does anyone have any questions?
Very good.
Great job, Lisa and your team. Thank you, Frank, thank you for your representation.
Frank's
Certainly
an
makes
awesome
our
job.
community stronger and helps us recruit people to this one.
So who are the organizations that are participants in this?
Is Buncombe County, the City of Asheville, MAHEC, University of North Carolina at Asheville, AB Tech, and Mission Health. It's over 15,000 employees represented, and the Chamber has a representative as well. But, you know, it really will help, I think, Asheville also economically going forward as you encourage a more diverse workforce. It's better for the community. We find we attract people here, Suzanne, but they don't stay.
They don't.
And they don't
They're
stay.
not connected until.
Exactly.
They leave.
So we hope that this will make a difference. Any other questions?
That was good.
Thank you.
Thank you.
Mandy?
I'm gonna be quick. Just gonna touch on a couple of things. I had the opportunity last week to present at legislative oversight for the North Carolina General Assembly about the impact of NC Fast and NC Tracks continues to drive most of my attention, and all of Philip's team should stand up. You talk about people who are working nonstop. Yeah, stand up, Kelly. And the impact, when you listen to it on that state level, that this is having statewide in terms of the economy, potential impact as we move into transitioning from food and nutrition to Medicaid on providers, and they get paid through the NC Track system is the data that's going into NC Tracks from NC Fast to Accurate. Most of the legislative oversight discussion about the budget, which Jennifer knows well, talked about the Medicaid shortfall, which they say is quote only 140 million. But quickly they also say their data is so inaccurate that they can make no accurate forecasting about either the number of eligibles or potential eligibles or actual cost overruns. And that is the whole of the discussion down there, is that they cannot nail those numbers. So we'll continue to watch that and see how that plays out for us. You all read or are aware that our own Terry Van Dyne was appointed to fill the late Senator Nesbitt's seat.
He was.
I have invited about 6 key organizations to meet with her at her request last week. She literally will go down, assume most of his committee seats, and a lot of which sit in education and health and human services, and vote on the budget. So she's asking for a briefing from key organizations. We're going to do that in an hour and a half for her before she leaves. And a key part of that is going to be those key leaders handing her cell phone. So when she gets down there and has a healthcare question, she knows who I call up here to help guide me on where I go. And the last thing I want to say is we've almost finished orientation in terms of, which is hard to believe we've been at it more than a year, in terms of the major divisions or departments in health and human services. And we want to move back into a frame that's more about bringing in communities and doing more panels, and I want to talk a little bit about that schedule. The last service area I haven't heard from at all, and Nell's over here. Nell and Angie will focus on next month foster care and population health and some of the integration efforts across those 2 departments. in June, get Dr. Munger to do an overview of our behavioral health investments and some of the key issues happening in that behavioral or mental health world. We have been working for about a year on a comprehensive domestic violence plan for Buncombe. It's an evidence-based program out of both Pitt County, Massachusetts, and at a High Point, brings different parts of all of that. We're gonna bring that panel together for you. Angie's gonna help lead that in July to talk about that. Literally is a program in Massachusetts where they've used, it's only one small piece of the program, but it's about a community saying we're not tolerating domestic violence anymore, uses components including electronic monitoring. The difference is the monitor goes not only on the offender but the victim, and the monitoring is the victim's parameter of safety, so you have 24/7 monitoring of that. Also uses a high-risk team where all of the organizations share information in one team. The DA is a part of that, so he's up-to-date information. It uses the evidence-based screening tool that Massachusetts went from 17 domestic violence homicides in a year over the course of this to 0, because the questioning from the first patrol officer on the scene to the victim advocate to the team highlights those behaviors we know predict the likelihood the victim will be killed as a result of domestic violence. So the county, that's one of our key funding issues for Health and Human Services. We want to bring you that whole panel. Everybody from Judge Hill, who's running it on the judicial side, to Ron Moore, the district attorney, to all of our police chiefs and sheriff, to Health and Human Services, all those components of it, and talk through all the components of that plan. Gibby's still going to do a wrap-up on public health. We didn't hit all of her areas. The community threat assessment team, which is all the anchor institutions, you heard a minute ago, share information, the schools are part of that, share information about individuals who pose threat to the community, and develop safety plans. And Lisa's going to help lead us with that team, from law enforcement to all our anchor institutions, that look at how we identify those individuals, how we share information across electronic systems to keep the community safe. There's a lot of tie-in to the domestic violence models. We're going to do those back to back with those community panels. Trauma is our other focus in the upcoming year, and going to lead a panel of both some national, local, and state experts about how trauma impacts children and adults in their life, and how that impacts our work in health and human services and the community as a whole. So again, bringing those community panels back and having those broader discussions. And then we will bring the Circles panel, or the poverty remediation, the groups that are going to work on our model around poverty remediation in the next year, and talk about the work we're going to do on the ground, both out in all the ends of the county as well as focused in the city around some of our housing developments. The other panel is the safety net panel, and that's the one we want to hold at Minnie Jones Health Clinic. Invite Mayhack, the broad spectrum of individuals working on our community safety net, hear about what are we seeing in terms of patterns and needs and unmet needs, and how are we targeting our dollars now, and is it the right way? The county, as you all know, funds Minnie Jones Healthcare Clinic significantly. We are also in the new year funding Mayhack for around some hospital discharges and high-risk individuals for access as well. So we're really trying to broaden how we build a sustainable safety net across the community. So to talk about all of those components, how does that fit with the work that CCNC does around the management of those individuals, and making sure we're using those public dollars to achieve the best outcomes? So I'll be glad to know that you'll be graduating out of orientation and maybe back into digging into the real work. And that is all I have to share. Thank you. Any questions?
I have a couple of comments. Thank you, Amanda. That's a very comprehensive report. I just saw that a politician had included in a political stand a criticism of the combined health and human services. I think that we need to go on record strongly as endorsing what we're doing, that the combination of those two programs is positive, and that all of the results we have seen indicate that, so that we're out in the front of that. This is also Administrative Assistance Week, and I know that for me, the glue that keeps this thing working well together is Krista, who, I don't know if y'all saw it, but my computer wasn't working. She was right here on top of that. She's on top of it when I send her an email, and I just would like for us to thank Krista for all she does.
She said I'd take the minutes, I'm thinking.
No.
No, but she's extremely patient. I know in the past I've served on the board a long time, and if I have a problem, I feel quite just really relaxed, just calling her or sending her a message, and she always responds in a timely fashion. And I'll say, sorry, I'm bothering you. She goes, that's no bother. You know, and it sort of makes you feel a little bit when somebody comes back and says that when you're having a bad day.
She takes good care of all of us.
Yes.
She's awesome. You're awesome.
Any other announcements?
Welcome to our county manager.
Hi, wonderful. Welcome. Glad you're here. Any other dates or announcements you've heard the schedule? And so we look forward to Angie and Nell's presentation in May. We do have a date of meeting change. You received an email asking about that Memorial Day weekend, so we've moved the meeting to the 30th.
I can
Meeting is on the 30th.
We missed some people either way, but I think the greater number.
Yeah, I can come.
Thank you for the communications today and the extremely customer-friendly driven. Sometimes we try to tell everything that we know on a very simple, on a very small piece of paper, and it gets confusing for our customers. So thank you for that, and thank you for the work for Child Abuse Prevention Month. It's such a message that we celebrate that month, and we're hoping that that month goes away because we don't have to celebrate that month. Anything else for the good of the group?
Nope.
Have a motion to adjourn. Winnie says we can go.
Yep.
See you next month.